Good evening, all. I'm now back after a long break. Now, today I'll be actually talking about, as I talk regularly, on certain clinical conditions. But before the talk, I would just like to inform all, if interested. I'm going to post some kind of information, very interesting information, any kind of interesting information daily. It will be tagged as one short daily talk. So it will be a live talk of a few minutes, but would be actually taken daily. Okay, some snippets, some information, some interesting fact, anything like that. Now today actually I'm going to talk about insulin resistance only, as I have been talking about diabetes also earlier. The thing is that, see, we have a misconception that insulin resistance is actually type 2 diabetes. As I have already discussed previously in my videos regarding the reversal of diabetes, that there are two kinds of diabetic conditions. One is a genetic condition which is present in a very earlier age, that is type 1 diabetes, where the person is actually dependent on insulin the whole life. So it is actually a deficiency of insulin because its production is not taking place due to some kind of a presence of autoantibodies which disrupt the beta cells of pancreas, which actually produce insulin. So there's insulin deficiency. Type 2 diabetes, which occurs at a later age due to various conditions. It can be genetic predisposition, it can be due to stress, it can be due to certain lifestyle factors, it can be due to certain habits which may precipitate such risk factors which can cause type 2 diabetes. And it is actually not a deficiency of insulin. In fact, the paradoxical condition is that there is a lot of insulin. It is a hyperinsulinemic state. But due to even high insulin, there is actually the effect of insulin is not there, because the tissues which actually were insulin sensitive previously have become insulin resistant. So it is actually condition which starts with insulin resistance, hyperinsulinemia, and then with the full-blown type 2 diabetes later on, and then can then progress to less or lower amounts of insulin because the beta cells get exhausted after a period of time. So we are not going to talk about diabetes. Actually, this is nothing connected to diabetes. Insulin resistance is actually the condition which can be present in a person who is not diabetic. Glucose levels might be normal also. Okay, that is, the person is not hyperglycemic but is insulin resistance. Okay, so insulin resistance is a condition which is very, very, you can say, becoming prevalent, or it is the main, you can say, the starting point for various problems. But as we can say that the measurement of insulin is not very, very common or recommended, so we mostly don't get our insulin levels checked. So if a person is having insulin resistance, it cannot be known, because if a person is having insulin resistance, the levels of insulin will be high in that person. Okay, so why we actually are talking about insulin resistance? Because this problem is actually leading to various health issues. One most common is diabetes, that is, ultimately you're going to end with hyperglycemia and then type 2 diabetes. Another is the concept of that becoming obese, overweight can be a condition or a factor which can predispose you to cardiovascular problems. Okay, and it is you can say not good for the body. High insulin levels is not good. I've discussed earlier also. So insulin resistance, it is actually most of the time not actually understood well. Now what happens is, like, what is happening, that this kind of a period, like where the children, where the teenagers, even adults, they are indulging in fast food, processed food, packaged food, and kind of to make the food tastier, most of the time we are eating some fried food with a lot of taste makers and all, okay, or snacking a lot, okay. So what is happening is that due to this kind of overeating, or due to the intake of more of processed foods which are high in carbohydrates, we are actually keeping our insulin levels high. And insulin is such a hormone which always has this you can say tendency to store the energy. Like if you're having high carbohydrate in the diet, it will store that carbohydrate in the form of glycogen. It will store the fats in the adipose tissue. Okay, it will direct the various nutrients towards the storage. Okay, and insulin is very important, you can say, hormone which initiates lipogenesis, or you can say fat accumulation. More the insulin, more will be the fat accumulation. Okay, now what we target is, we mostly say that lower the carbohydrates, okay, but people still have this mindset that we have to lower the fats. So we actually take less of carbohydrates, less of fats, and we may switch towards more of protein. So if you're taking only a protein diet, like mostly when the people who go to the gym regularly, the teenagers, the gym goers, they have this tendency or habit of having a protein shake, pure protein they are going to take, so that they can actually replenish the muscle protein because of the resistance training and the kind of exercise and strength training they are undergoing. Okay, if you're taking only protein, it is not very helpful. Okay, so along with protein, fat should be also taken. Protein will be will be helpful in building the muscles, or will take an anabolic role only when it is taken along with some fat. Only protein if you're taking, then it is not going to serve the purpose of anabolism or build the muscle protein. Okay, now what happens is that over a period of time, when we are having this kind of food, processed food, and lots of eating, okay, in between snacking and all, having less gap between the eating periods, the body is actually having high insulin level. It is actually leading to more of lipogenesis. Basically, lipogenesis is one factor. Another thing it is actually leading to the hypertrophy and hyperplasia of fat cells, which means that the fat cells, they grow in number and they become larger in size, or hypertrophied. Okay, these large size fat cells, then they actually tend to burst and release or leak the fats. These kind of leaky fats, you can say, they lead to the inflammatory condition, which causes the release of various inflammatory markers, and that leads to a condition, there's a pro-inflammatory condition in the body along with the high insulin, which then makes us insulin resistant, and then ultimately diabetic. And this is also a harbinger of, or initiator of, various other problems like the cardiovascular issues also. We have this concept in our mind that the bad cholesterol, you can say that the LDL, low density lipoprotein, or high cholesterol, is actually the culprit in causing the cardiovascular issues. But what is important is that you have to keep your sugar levels or your carbohydrate intake in check, so that your insulin does not go high. Basically, what is leading to the cardiovascular problems is not the LDL or not the high cholesterol. You take saturated fat, you're not going to get a cardiovascular issue. If you're taking polyunsaturated fat, more of omega-6 fatty acids, you're going to have a tendency towards making more of free radicals, and that can lead to metabolic issues. But the first thing is, when you're becoming insulin resistant, you're actually leading or progressing towards heart problems also, because that is a pro-inflammatory condition, and that is going to lead to formation of abnormal fat cells. And these abnormal fat cells will attract the macrophages, because the macrophages will find them as foreign substances. This kind of fighting in the body, active immune processes, this acute inflammatory condition actually leads to various processes, which also includes the plaque formation in the heart vessels, and that can lead to the cardiovascular events or coronary artery disease. So, we tend to ignore that the main thing which is actually disturbing the metabolic flexibility of the body, or making us metabolically inflexible, is our high insulin levels. I've taken a video on metabolic flexibility also, and I'm going to repeat again that if you want to keep your body metabolically flexible, that is when you had your lunch or dinner, you had your food, you are in a high energy state, then your insulin levels will come into play and store that in the form of energy. And when you are actually in a condition where you require energy, whether you're exercising or you're not having anything, then the glucagon is going to release that energy to actually provide it to the brain and the various other systems. Okay, that is the nervous system also. So basically the main role is that you keep yourself metabolically flexible. If you become consistent in your eating habits, you keep a gap between the dinner time and the next day breakfast, you keep about a span of 12 hours of not eating anything. If you practice all this and a healthy diet, then your body will be metabolically flexible. See, there is a connection between our habits, our lifestyle, because the pro-inflammatory condition can be generated either due to intake of high processed food, can be generated either due to high stress levels. Acute stress or acute, you can say, inflammatory condition is directly related to the stress, and that stress, or you can say, that can lead to high blood pressure, which is again directly related to less of sleep, more of work or running, racing, being busy all the time. All this also actually activates the sympathetic system, activates the epinephrine, norepinephrine hormones, which always keep our system in an active and metabolically active state. So we have to be in such a state when our body is actually resting, when it is not metabolically very active, and it is actually building up the energy stores, and when it is required, that body becomes metabolically active and it's then releasing those energy stores. So if we keep a balance in our habits, in our lifestyle, in the amount of stress we are taking, we give ample rest to the body, we practice some kind of intermittent fasting, we actually avoid processed foods, high carb foods, instead we take more of fibers, more of saturated fats, more of proteins also, all in balance actually, not more, but you can say that it should be taken in balanced manner. Okay, but please avoid the simple carbs or simple sugars or added sugars, okay, which are found in artificial, or you can say the snacks, the beverages and all. So if you're practicing this, you're keeping your body metabolically flexible, then the whole system will work properly. Okay, so that is very, very important, because the main point is that we shouldn't be drifting towards insulin resistance or keeping our body insulin high. So this is very important to avoid various clinical conditions to appear at an early age. So I hope this discussion would be very helpful, and I will take other discussions in further period of time. Thank you. Bye.